Hello. Today I'm going to perform a thorax and a lung assessment, and I have an otherwise healthy male, and we'll begin with my assessment. At this time, I'm going to go ahead and inspect for any asymmetry. Patients' respirations are regular, unlabored, with normal inspiration and expiration. And what I'm looking for is for any rapid, shallow, labor breathing, any signs of respiratory distress at this time. We're going to look at his configuration. Um, what I'm looking for on a chest is for a normal cone-shaped abnormality such as barrel chest or emphysema patients or patients that have different colors, whether they're pink, what we call pink puffers for emphysema patients and blue bars for patients that are COPD, and they're usually obese, and you can see that they have abdominal breathing trying to compensate. Also, the respirations should be at a rate between 12 and 20. Obviously, he's in no respiratory distress. So I'm going to inspect for the anterior posterior, and what I'm looking for is a normal anterior posterior chest with less than transverse diameter, and thorax should be elliptical. Um, there's no signs of any abnormal curvature in the spine, such as lordosis, kyphosis, or any scoliosis. Um, we're going to go ahead at this point assess for a tactile firmness. And I am going to ask my patient to go ahead and tell me either 99 or blue moon, and as I'm palpating. Go ahead, blue 99. 99, 99, 99, 99, 99, 99, 99. And I'm also going to go ahead and do that from the posterior aspect. 99, 99, 99, 99, 99, 99, 99, 99. In this case, what I'm looking for is obviously normal versus abnormal. In this case, it's normal. I can feel the vibration. Either the normals should be anywhere between dull or hyperresonance, indicative, or could be a COPD patient. It could be patient with pleurisy, patient with pulmonary edema, consolidation, pneumonia, those type of things. I'm going to go ahead and assess for I'm going to ask for my patient to take a deep inspiration. Notice any abnormalities. Chest rise is equal bilaterally. Also, go ahead and palpate and check for CVA tenderness. Is that painful? No. We call for CVA tenderness indicative of a kidney infection or any kidney abnormalities. At this time, I'm going to go ahead and auscultate, and what I'm looking for is equal breath sounds, no augmentation sounds, and normal sounds such as wheezing, bronchi, crackles, any stridor, either all indicative of respiratory obstruction, pneumonia, congestive heart failure, trauma, and the trauma settings such as tension pneumothorax or hemothorax. Go ahead and start. Deep breath. also check for from a posterior aspect as well. We'll begin. Good deep breath for me. My patient exhibiting clear lung sounds. Um, Also, I am going to go ahead and conduct a percussion, and we'll begin from the interior aspect. And then from a posterior aspect. What I'm looking for with the percussion is to, again, assess for any abnormalities. In this case, I'm looking for any consolidation, any signs of fluid accumulation, such as heart failure patients or pleural effusions, things of that nature, or in patients that have chronic obstructive airways, such as COPD, they will be usually hyperresonant versus the others will be more like dull. At this time, I would like to go ahead and conduct an axillary. And what I'm going to ask for my patient is to raise his arm. And what I'm looking for is I'm trying to identify the axillary lymph nodes, which starts pretty much from the pectoralis, also the central, subscapular, and the lateral. And usually the axillary, they're deep. And again, I'm looking for any abnormalities, any tenderness, any warmth, if they feel rubbery, all indicative of possible infectious or some sort of a cancer form. Last but not least, I would like to perform a breast exam. In this case, my patient is a male. Males don't have a tendency of developing breast cancer, but when they do, it's usually right around somewhere in between the areola from the nipple area up to the right upper quadrant area. And I'll be asking for my patient for any signs of not feeling well, obviously, any tenderness, any pain, and if there's some sort of a kind of a sore, if they're having any discharge or any bleeding or anything of that nature. Obviously, if my patient was to be a female, I will be asking, actually, I will be assessing for certain breast cancer risk factors, such as being the age over 40, or a patient who's 30 years old, has not conceived a child, or for someone who hasn't had a self-breast examination or a clinical breast examination, and also there's any family history of cancer, first siblings, and also if they're postmenopausal or if they have been doing it after the age of 40 or doing it on a yearly basis, as per stated from the Breast Cancer Awareness Association. Other than that, I conclude my assessment at this time. Thank you very much.